only leave home for essential activities such as going to work or school, for healthcare purposes, or to care for family members or to buy food. It recommends that we avoid leaving home if you're over 65 or at risk for developing serious illness. We suggest that you use delivery services or alternative pickup methods for food and retail. Avoid gathering with people who you do not live with, wearing your mask and keeping the distance from people when you leave home, and avoid any indoor public.
That happen over bond cycles and over.
Gibbie, sorry, you're on mute right now.
Have I been mute the whole time?
No.
And now Meg's on mute. Okay, so hopefully I got through the secretarial directive. I apologize for any snafu that we had here. The other thing that I want to remind our citizens of as we're working through the different phases with vaccines is that we are only able to provide as much vaccine as we receive from the state, and they're only able to provide us with as much vaccine as they receive from the federal government. We are working tirelessly to get the vaccine out to the appropriate populations as quickly as we can, but we ask for your patience as we move through this process. We know that people are anxious and that they want to be vaccinated, and we'll do everything we can to get them in. Our staff are doing what they can to answer the telephone calls and the emails that we have coming in, and we'll get back to you as quickly as we can. But again, we ask for patience as we continue to work through this process. Now I'm going to let Dr. Sullivan give us an update on where we are with vaccines right now.
Thank you, Gibbie. So again, I think as always, I just want to reiterate what Gibbie said about the numbers in our community are not where they need to be, and that our focus absolutely needs to continue to be on prevention and adhering to COVID precautions, including the new secretarial directive at all times. We also obviously continue to be very focused on vaccine delivery as we work to get vaccine out as quickly and equitably as possible. We currently continue to vaccinate at Bojangles. We are still doing it 6 days a week, Monday through Saturday. We are continuing to work to provide appointments for our phase 1A individuals who are healthcare workers who are critical to COVID response due to their work caring for or working in areas where patients with COVID-19 are cared for, as well as our long-term care facility residents and staff. And as of earlier this week, we also started vaccinating individuals in phase 1B group 1, which is individuals ages 75 years of age or older. 2 days ago, we opened up appointments through the end of January for our phase 1B group 1, as well as phase 1A, and to date have booked over 5,000 appointments for phase 1B group 1. We continue to work to open additional slots for this phase, the phase 1B group 1, but the number of slots that we will be able to open depends both on the number of phase 1A appointments that we are still filling, as well as Gibbie mentioned, the vaccine supply that we receive from the state. As of yesterday evening, we have given almost 2,450 doses, and we expect to give out an additional 400 doses today. Talked about 2 days ago, we received an additional supply of 1,950 doses and expect to get those out in the next several days. And as of to date, we have not yet learned how many doses we will receive next week, but as soon as we do, we will make that number available. We also have staff continuing to work tirelessly on our hotline. We are aware that we still continue to have challenges with our phones and experiencing challenges with technology this morning. Our staff are really working extra time. We have extra staff devoted to it, and they're working tirelessly to answer as many calls and return our calls as quickly as possible. We also have staff working and responding to our emails as quickly as possible. Those are all the updates I have, and now we're happy to answer any questions.
Robin Kennedy, go ahead.
Good afternoon. We are here. This is Robin with Fox 46. We are hearing reports that Atrium, Maine is slammed and overwhelmed with COVID patients, so much so that they are elevated to mass casualty alert status. Is that the case, and what does that mean for the public?
We do know that Atrium Maine has reached some level of capacity. We continue to be assured by the hospital that they have the ability to surge if needed, and they are continuing to look very seriously at other activities with individuals who don't necessarily need to be in the hospital right this minute. So at this point, we are being told by Atrium Health that they are able to handle the situation and that there is no need for anyone to avoid going to the hospital if they need to be there. So at this point, what we're recommending is that if you are ill, whether it's COVID or something else that requires immediate attention, that you still access the hospital, and they are prepared to be able to treat people as they come in.
Hi, this is Brett Jensen with WBT. I'm curious. I asked you guys the other day if you guys were short-staffed, and have enough people to actually administer the vaccine. Let's say by some freak of nature, you guys actually start getting more and more vaccines, say maybe 3,000 a week, 4,000 a week, what have you. Would you guys have the capability to administer all those in a week, or would you have to bring in more staff?
We are constantly planning around how we could accommodate more vaccine if we were able to receive it. We're looking at our community partners that we might be able to work with. We do have the ability for those facilities that have been approved by the state to provide vaccine to move some vaccine to others in the community to provide if we have that vaccine available. So we are in the planning stages all the time of looking at what our next options would be and what capacity we have to expand. We want to make sure that if we get the vaccine, that we're able to get it out as quickly as possible.
This is Katie Peralta with Axios Charlotte. Recently, the governor said that they are deploying National Guardsmen across the state to help with vaccine administration and any other help that counties need. I'm just curious how many of these National Guards members are in Mecklenburg County, and is that number expected to change given the trends that you guys are seeing?
We've been lucky to have the National Guard with us since mid-fall. They worked with us a lot on testing in the community, and now are working with us on vaccinations. I think we've had as many as 10 assigned to the county, and as we understand, they'll be available to us through March. We are having more conversations with the state and making requests for the potential for more National Guard to help us. They've been very helpful, and I'm always getting good reports, both from individuals who are interacting with them as well as with our staff about how pleasant everyone is and how helpful they are. So we're very grateful to have the National Guard here.
Hi, this is Caroline Hicks with WBTV. Can you talk a little bit about how the first day of the 1B clinic went? Roughly how many people were able to get a vaccination, and what you're recommending for people who are in that group but unable to get an appointment? Are you recommending that they do reach out to the hospitals?
So thank you. So yesterday was our first official day of Phase 1B Group 1. We were able to provide approximately 350 vaccines in the day. I think that went very smoothly. We heard several. I had the personal opportunity to talk with several people who were incredibly appreciative of that opportunity. In terms of, as we said, we know that our appointments filled up quickly. We are working to open up additional appointments. We really encourage people to continue to check on our website. We are keeping our website updated every single day and really trying to make sure that any new information is available on that. And then we will also share the information with the public as it becomes available as well.
We are recommending, if individuals have a relationship with either of the healthcare systems through their private providers, that they contact them first, because both hospital systems do have some vaccine that they're making available for that age group as well. So we're trying to work with our partners to make sure that it's readily available, or as available as it can be, across all three organizations.
Hi there, this is Ruben from Spectrum News. Gibbie, I wonder if you could just elaborate a little bit on the some level of capacity at Atrium, Maine. Are you talking 90, 95%? Do you have a sense of the number? And I know you've been asked this, over the past few months, but any sense of whether a field hospital at any point might be more needed, considering you look at Western North Carolina, they just got one over the past couple of weeks?
So the latest report that we got from the hospitals is that they're anywhere from 90 to 95% capacity at this point. So they still do have some capacity available, and the same is true in their intensive care units. And that is prior to implementing any of their surge plans that would allow them to open more beds if needed. As we've said before, up to this week, they've been operating normally with the same number of procedures and things that they normally do this time of year. They're looking at that as well very carefully right now, and being careful about what they plan moving forward. At this point, we still do not have any plans for a field hospital in Mecklenburg County. What we are dependent on our hospitals to let us know if they believe at some point that might be needed. I do know that the state has had conversations across a number of counties in the state about the potential for locating field hospitals if needed, but again, no specific plans have been made here.
Allison Kuznets, next question. Okay, go ahead, Joe Bruno.
Hey, I have two. First question is for Gibbie Harris. Gibbie, are you vaccinated?
I have been vaccinated. Actually, to be perfectly honest, I'm not one of those healthcare providers that really needed to be vaccinated in the first round. But I happened to be in the office late one afternoon when we had a couple of vaccines left over. And as we've said, we're very careful not to waste vaccine. And my arm was available, so I have been vaccinated.
How was your experience? Any side effects?
I had just minor soreness in my arm. I actually had the Shingrix vaccine not too long ago, and I had much more trouble with that than I had with this vaccine. It was very easy.
One more question, if you don't mind. Some counties and in other states too, they're doing this. They're doing like drive-up COVID vaccine clinics where no appointment is necessary. Do you envision Mecklenburg County having something similar in the future when more vaccine is available? I also know that that's leading to a lot of people like camping out overnight in extremely long lines. So I'm just wondering what your thought is there.
So we don't rule out any potential options in the future based on how much vaccine we have, what the weather's like, who we're trying to vaccinate. And at some point we may go to that. I will tell you, I've been watching some of those lines on the news, and especially since we're looking at 75 and older here in Mecklenburg County, I just don't think that's a good idea. We have stuck to the appointment process. It has been an incredibly well-designed and streamlined process that's working the way we need it to work. And for the foreseeable future, I do believe we'll be sticking to that process. Where we go in the future depends on how much vaccine and what populations we're needing to vaccinate.
Hi, Gibbie. This is Hannah Smoot. Can you share how many hospital workers are quarantining or isolating right now? And then if hospitals do say, it's time to pull the trigger, it's time to get a field hospital open, how long would that take to get a field hospital up and running once that's needed?
Both good questions. We don't have the specific numbers on the healthcare providers from the hospital systems. Obviously, they're reported through the same system that we have, but the hospitals have been handling the contact tracing of their own teammates. They have the capacity to do that for us. So I don't actually have those particular numbers. We have heard from the hospitals that they do have quite a few who are on isolation and quarantine, and they have to continue to manage that too as they're looking at expanding beds. We've been told in the past that a field hospital could be set up as early as 2 weeks out. I'm not sure whether they've honed that in and can do more than that at this point. That actually would be driven by state emergency management if there was a need to open one in this area. And so they would be responsible for the logistics of getting that set up. We could try to find out more information for you.
Hey, give me Brett Jensen again. I'm curious. You said you got vaccinated. Are you aware of any city or government officials in terms of the politicians, commissioners, or council members, or even Dina Diorio for that matter, that else has also gotten vaccinated? I'm sorry, you're on mute, Gibbie.
Sorry about that. We did vaccinate a Commissioner Bill Malik this morning. And we actually videoed that. We're working with the state on a few spots that we will be able to provide in the future. So she was vaccinated this morning. The manager has not been vaccinated. She is waiting for her time when it's right, and she will take the vaccine when it is her spots available. So at this point, the only one that I'm aware of is Commissioner Leak. We are reaching out to the other commissioners who fall into the current age group that is being vaccinated, and will provide vaccine for them if they're eligible.
And real quick, a quick follow-up on the earlier question, I believe it was about the hospital capacity. You said it was about 90 or 95%, but that's pretty normal in any year, correct?
Especially this time of year in the winter, when we're seeing other viruses that are creating problems in our community. So that is not an unusual percentage of hospitalization. Correct. And one thing I didn't mention is the other person that was vaccinated this morning was Senator Carney. She came in for her vaccine this morning as well.
Gibbie, this is Robin again with Fox 46. I know you said that once they reach, excuse me, 100%, then that surge could kick in. So the hospitals are still able to handle some of the surge beyond the 100% capacity. How much are they able to handle beyond that 100%?
You know, the numbers tend to be sort of fluid, so I'd really have to defer to the hospitals to give you any specificity around that.
And when you did, you were referring to Novant Presbyterian and Atrium Maine on the 90 to 95% capacity.
Actually, I think that is across the hospitals that they manage in the county. So that includes the other smaller hospitals.
Gibbie, this is Hannah Smoot. You said that you expect cases to remain high through mid-February. Are you saying that they'll remain about as high as they are now, or should we expect to see cases continue rising all the way through mid-February?
We anticipate seeing cases rise over at least the next couple of weeks based on activities that took place during the holiday season. Whether it continues to rise through mid-February, I'm hoping that's not going to be the case. But what we anticipate based on the models that we've been looking at is that our numbers will remain high through mid-February.
Got it. Thank you. And regarding hospitalizations, have you heard anything about hospitals needing to, double bunk patients in ICU rooms?
I've heard nothing about that in Mecklenburg County from either of our hospital systems.
This is Katie Peralta again. I had a question. How many vaccinations across the county, across the hospital systems, How many vaccinations do you predict it will take before we see COVID cases in Mecklenburg County start to decline?
Meg, would you like to answer that one?
Sure. So I think we're obviously incredibly excited about the vaccine, and especially the two vaccines that have currently been approved have shown, incredible effectiveness, 94 and 95%, against protecting an individual from getting sick with COVID. But we know that it is going to take a very long time and a lot of people that need to be vaccinated before we really start seeing that impact. When you talk about what we need in order for COVID cases to decline, it is really about prevention. It's really about preventing those cases. We cannot rely on the vaccine and wait for the vaccine to get out. We need to act now. You've heard us say the same things over and over again around avoiding any place that you do not absolutely have to be, wearing a mask at all times, socially distancing, staying home if you're sick, abiding by isolation and quarantine guidance, answering the call when public health calls. These are the things that are going to drive cases down. Again, we're trying to get vaccine out as safely and equitably as possible, but it is the amount of vaccine that we have right now, the focus really needs to be on prevention for these cases.
This is Robin again with Fox 46. Would the main hospitals, Novant and Atrium, would their capacity affect other smaller rural hospitals that send patients to those hospitals if they get full?
Again, that's a question that I'll need to defer to the hospital systems. I do know that some of these smaller hospitals are on diversion right now. They just don't have capacity. And I know our hospital systems are addressing some of those issues, but you'd really need to talk to them about specifics.
And what are you hearing from the hospitals as far as staffing goes? Are they do they have enough staff? Is that a concern, especially with them being in quarantine, some of them?
Just as it is for our first responders who have people who are isolated and quarantined, obviously that's an ongoing concern. But I do know that they are working to address that on a regular basis and making sure that they've got sufficient staff to take care of the patients that they have in the hospital.
Do you have demographic information for the 5,000 people who signed up for a COVID vaccine in 1B?
No, we do not have that at this point. When we take an appointment, we don't ask demographic information at the time, and we're still waiting for the state system to be able to provide demographic data back to us on all the folks that have been vaccinated in Mecklenburg County. So we really don't have good data around that at this point.
So then how will you make sure that it's fairly distributed amongst everybody who lives in all parts of Mecklenburg County?
We're doing the best we can by getting information out and making sure that appointments are available to those who may have harder time making appointments. That's why we're doing telephone appointments. I know there's some places that are only allowing appointments over the internet. We've made those appointments available. We've gotten information out as best we can. And until we actually get an eye on that data, it's really hard for us to know. So we, again, are continuing to try to work with the state to push that along as quickly as we can.
Hi, this is Vanessa Rufus with WCNC Charlotte. I remember the last time that you guys had the briefing, you were asked whether county leaders were talking about adding any new restrictions to help curb the numbers. You said that, quite frankly, you were waiting to see what the governor did this week. So obviously the governor has made his announcement about the extension of the current modified stay-at-home order. Now that you guys know what's to come, do you think there will be any further discussion now on the county level about restrictions?
At this point, we are continuing to stay with the governor's order. I want to reiterate the secretarial directive that came out yesterday and really encourage people to pay close attention to that. We are hoping, as always, for our community to work with us and to be diligent about doing the things that we're asking you to do right now without having to enforce more. or put more restrictions in place. But I will say that those things are always on the table, and we'll continue to have conversations if we need to.
Okay, last question, please.
Hi, Gibby. This is Hannah Smoot again. Just wanted to ask, you mentioned some of the smaller hospitals are on diversion. Can you specify which one those are? And then, we've seen other counties open up field hospitals. Why, can you sort of explain why that's needed in some of those more rural counties, but we're not at that point yet?
I think there's one of the things we have going for us here in Mecklenburg County is we have two very large hospital systems. And those systems have lots of resources, as well as the two big hospitals that allow us to accommodate and to manage a little bit better than some of the more rural hospitals can. So the hospital, hospital that's been set up in Caldwell County is serving Caldwell as well as a handful of other rural counties further north of there. Because all of those hospitals were well over 100% capacity. But I think having both systems here and having the additional resources we have here allows us to manage that a little bit better here at this point in time. And the census changes daily in the hospitals. So I mentioned the hospitals that we knew of a couple of days ago that were on diversion. I don't know today where those hospitals are in the county.
Do you know how many?
No, I don't. I really don't. The hospitals would be a better source of information on that. We thank you all for your time today.
Thank you, everyone.
And look forward to talking to you again in the future. Thank you.
Thank you.